Too many recordings. All right,
I'm sorry.
that's fine. Great. So let's talk about better understanding the comprehensive evaluation that comes off an isokinetic test, specifically the Biodex fourth generation software. So in this instance, we did knee extension and flexion at 60 degrees per second and 180 degrees per second. So let's, it gives, it's wonderful in the sense that it gives you a lot of information to look at, but making this relevant and understanding where to turn your attention can be challenging because not all metrics are created equal. All right, we want to kind of cherry pick our key performance indicators, or things that I call our key functional indicators, our KFIs. So let's go through them in turn. I will highlight the, keep them green as far as the ones that are key indicators or KFIs. So peak torque. This is the amount of force that they produce throughout their range of motion for their extension and their flexion. Pretty straightforward. Next metric, also important, is it starts to normalize that relative to their body weight. So for males between 20 and 50 years of age, up to 60, at least the Biodex will say that it's normative ranges for them, it should be around 100% of their body weight, with a standard deviation of 15% in either direction. So 86% would be the bottom, and then 115 would be the upper bound. And you can see that represented in the graphical report.
That goes for both conditions?
No, that goes for your
Okay, so
quadriceps.
okay.
Yeah,
Got it.
for your it would not be. I've never seen anyone produce 100% of their body weight with their hamstrings, but I'm sure that they exist. Typically, it's going to be 60% or so of your quadricep strength.
Got it.
So here, your mean, if you do the math, between 52 and 70 would be 61% of body weight would be the mean. And then one standard deviation below would be 52, and one standard deviation above would be 70% of body weight. They don't give you the reference here, they just calculate the deficit between the two. But yeah, so you may need, if you haven't memorized those numbers, you would need to look back at the actual graphical representation or in the manual for the Biodex.
Okay, but quad both like 60 and 180 degree conditions.
No.
Oh, okay.
So the faster the speed, the more
less force you produce.
Yes, very good.
Got it.
So we would also expect an isometric test to be higher than what they can produce with a 60 degree.
Makes sense. Okay.
Nice. All right. Time to peak torque. That one doesn't get highlighted. That's kind of a fluffy one. What does that mean? It means like it's highly variable. So it's their time from point 0 to their peak force production. What is more important than their time to peak torque, because they're looking at, essentially they're quantifying this interval, right, is their angle of peak torque. That would be a more robust metric. And you can see, for instance, for the hamstrings, notice that they started at least for his best repetition, there was kind of a little bit of a lag between his knee extension and his knee flexion. And so his time to peak, if we scroll up, well, yeah, so you can see that it's like off, right? But that's why I call it a fluffy metric. It's because it's variable, right? And he also produced more force with his right hamstring. So if you were to look at the numbers in themselves, you could be fooled to say that there's a meaningful discrepancy. Percentage-wise, it's not that big, but yeah. And I actually don't know how whether the software calculates it directly from the onset of force, or usually there's like a minimal threshold of which you identify as being time point 0 for that. Angle of peak torque is noteworthy.
Favorite.
Yep. So it's most important for your hamstring versus your quadricep, but it's valuable in both instances. It's just reported more so in the hamstring literature as far as preventative against hamstring strains. And so 69 degrees versus 61 degrees, 38 versus 33. So he's stronger at length on the right leg in both instances.
Degrees. Okay, got it.
That could be a meaningful metric. I don't use it as much. I guess we need maybe a different color coding for it. So it's valuable. It's not fluffy. It's pretty reliable as long as you've set your arc of motion appropriately. Torque at 30 degrees per second. Or 30 degrees, not per second. This would be looking at so on the second y-axis, you have 0 all the way up to 360, but no one's needs to go 360 degrees, right? So in this arc of motion, the green line represents the second y-axis.
Okay.
So if we were to draw a line over from this hash mark is 30 degrees, it's taking, like, what is the force at this 30-degree marker? So first to click out of it and then draw it up. So it is reporting the difference here.
Oh.
And the difference between those two is about 8.6%.
Okay.
Does that make sense?
Yeah.
And that is a metric that you can change. So if you, before you click on the report, it asks you what you want your torque, at what degree do you want it reported at? And you could do 60, you could do 90, you could do whatever you wanted with that. In this instance, with an extensor mechanism, MPFL injury, that would be a reasonable degree to look at. Keep in mind that this number, not in this case, can be augmented compared to their actual deficit in their torque. What do I mean by augmented? I mean that it can be dramatized because of the lower forces that are produced as someone gets to closer knee extension, that the percentage deficit can be much larger.
Okay.
Right? So, like, for instance, if he only was producing 10 foot-pounds versus 6.5 foot-pounds, now that's only a 3.5 foot-pound difference, but percentage-wise, it would say that he has a 35% difference. Yeah. Right? So just acknowledge that, don't be fooled by the percentage, but I would say that that's of noteworthy.
Okay.
This one you can disregard completely. It's recording. Yeah. Are we good on time? Okay. Yeah, so it's been shown to be invalid to do rate of force development in a dynamic setup such as this. You want to do it in it's more of a robust metric when done in an isometric setup.
Yeah, we talked about that.
Okay. Coefficient of variance. This is important. Ideally, you want it less than 15%.
Okay.
This is the amount of variance that exists from one repetition to the next.
Okay.
This is going to automatically increase with larger ranges of motion, smaller joints, and with faster speeds. Why would that be the case? Because the variability of me doing this with my finger, going into flexion and extension really quickly, I'm less coordinated than like I am like this. You can see that being very consistent. And if I'm slow, I'm going to be more consistent than if I'm doing really rapid.
Got it.
But so keep that in mind when you use that 15% barometer. But typically, for a valid test, at least in this case, we would want it less than 15%, especially if it's their first time doing it. This guy learned very well. It's all within normal limits. Max rep of total work. So total work is the area under the curve. So of all the repetitions that he did, what rep has the greatest area under the curve? I would say that that's of noteworthy, but it's not my primary.
Got it.
Max work rep, it just tells you which rep that was.
Oh, okay. So this corresponds with that guy.
Yeah.
Okay.
So on both instances, it was his first rep, except for his hamstring on his right side. His best work rep was his fifth. Work relative to body weight just normalizes that, so you could compare that across patients if you so choose.
Okay. Have we gotten to the one where you can tell if they're cheating or not?
That's the coefficient of variance.
Oh, it is. Okay. All right.
It's not cheating. It could be cheating, but yeah, if they're flopping the test or if they're still learning.
Okay.
Yeah.
Got it.
They're not giving their full effort.
Yeah.
Yep. There'd be more variance when people aren't acclimated to the test or they're not giving their full
And the number
effort.
would be bigger.
Very good.
Okay.
Because it'd be more variance.
Makes sense.
Okay. And then you look at total work. So that one is meaningful for me because instead of just taking their best repetition, it's the area under the curve for their quadricep over the entire duration of the set. Okay, work in the first third versus last third. I'm going to leave those off. That's not important, but what that does is it calculates a work fatigue. So it's taking it, this number here, the 12.9, is suggesting that their work in the last third of the set is 12%, almost 13% less than the first third. So it's how they're fatiguing over the duration of the set.
Okay.
In a setup like this, where you only have 5 repetitions, it's not really relevant because there's not a lot of fatigue there.
Mm-hmm.
Unless, if they had a significant drop off, that would maybe raise your eyebrows, right? Just because you wouldn't expect a lot of fatigue over such a short set. And there are fatigue protocols that you can use where you do it for like 25 repetitions. Gosh. And that would be more of an endurance, and your determination for endurance would be total work as well as work to fatigue. Okay. Average power, I don't utilize this. I don't know if that's right or wrong. It's just not something that I consistently track. There are reports of what is the joint power with running and other activities that have been looked at in biomechanical references. So if we just okay, so this is what I was talking about. So one of the things that we talked about in the Return to Running lecture is that there have been described knee joint power with running at different speeds.
Mm-hmm.
See these arbitrary units of 1.91, 2.27, etc. And this is foot-pounds. So your torque divided by seconds divided by body weight. So this is normalized power to the body weight.
Okay.
What are watts? Watts are just this. It's the rate at which torque is executed.
Okay. Rate which torque is executed.
So yeah, so it's like divided by seconds.
Okay.
So if we keep that in mind, we go back to our average power in watts. So over the course of that entire set, an average, it's like what is his torque like? So it's taking the total torque and dividing it by the seconds it took him to do the exercise or the assessment. That time is usually pretty consistent because it's set number of repetitions at a set speed. The only variable would be potentially if they weren't getting up to speed,
Mm-hmm.
if they weren't getting to 60 degrees per second, because that's a possibility,
Yeah.
or if their arc of motion was shortened.
Okay.
But I haven't really utilized it. Acceleration time and deceleration time, not important. Range of motion, that is important. So when you're setting up the test, this is like just a double check.
Yeah.
I don't have it as a green, but I usually always set it to 100 degrees of an arc.
Full. Okay.
That because
I think I had just over 100 from him.
Yeah, you had 103.
Okay.
Yep.
Can there be a little bit of variability there?
It can, but if it was significant enough, a degree is not.
Okay.
But what would that affect? It would affect your total work.
Okay.
right? So your total work, you can't and if you weren't consistent from one setup to the next, for instance, like next time you test them, say you did 90 degrees versus 103,
That will.
then when you look at his total work and you're like, oh, your total work dropped off. Did it?
Well,
or is it just because his arc of motion
was less?
was less? Average peak torque, this is taking the, not just cherry picking the best peak torque, which is shown here over the 5 repetitions, but averaging the peak torque of the 5 reps.
Okay.
And then the agonist versus the antagonist. This is your quadricep, looking at your hamstrings divided by your quadricep force. And our goal is like 61% versus, in this case, he's quad dominant on his right, and then on his left limb, what we see is because he's weaker by 22% on his left, then he's going to have an augmented ratio.
Where is the 61% coming from?
Literature.
Oh, okay.
Normative values.
So that's consistent across. That's not dependent on his demographics.
Yes, it is, because females will have a different goal.
Understood. Okay, but age range, it's okay.
And it's also dependent on the speed, I'm pretty sure. So if we scroll down to here, it's now 72.
With the
At
180 degree
180
condition.
degrees,
Okay.
yeah.
Okay. I think the only thing I don't want to hit, but how are we interpreting those? Like, how did you come to the inference that you did? The agonist, I'm assuming, is
hamstring. It's hamstring divided by quadricep.
Can you scroll up to the top?
Sure.
Oh, I understand. All right, I got
So
it.
to get to that 45, they are taking this value and dividing it by that value.
Got it. Okay.
And to get to the 57, it's the 74.5 divided by your 128.
Okay. That makes sense. Thank you.
Other questions here?
I don't think so. It's helpful to just tease out what is like the most important. And that's good to know with the hamstring quad ratio, because I didn't even consider that.
Yeah, beyond all else, the most important is the normality of the strength curve, in my opinion. That's first and foremost. It tells you whether there's pathology in there.
I was going to ask you what you thought of his, because to me, when I look at this, I mean, it's obviously the less jagged it is, the better, the more smooth the curve. But to me, that doesn't look super.
I consider that to be completely normal.
Okay.
Yeah. So you're not looking at jaggedness. You also are looking at the normality of the curve. Like, so that's going to be dependent from one muscle group to the next.
Sure.
And you won't be familiar with it unless you test more.
Yeah. Sure.
Like if you look at this versus like a plantar flexion strength curve.
Yeah.
Which,
or like the boxy when we tested, or no?
Nope.
Oh,
it's more like a child playground slide.
Child playground slide.
It looks like this.
Gotcha. I was picturing like I don't know why that was what came to my brain, the tube one that you go down. It's like, okay. Okay, understood. Then maybe I need to look up like the perfect, like the epitome of a strength curve for the quad, and then my brain will have like a mental picture.
I call it a haystack.
Okay.
It should be
like a nice little barrel shape.
Yeah. Usually he has a particular amount of, a lot of force produced kind of in the middle range.
Mm-hmm.
And then, but he also like spends a lot of time like this.
Sure.
So that kind of makes sense.
And this hump, since these are peak torques of the value here, this should be hamstring. Yeah, right. Should be. This is just applying everything. 60% of the strength curves there, ish. If we're talking about the ratios, or am I completely mixing that up?
So what we should see is that this and this So his peak values.
Yes.
That this point should be 60% of that
Got
point.
it. Okay, that's what I was trying to say.
And now it's only at 45%. And the normality strength curve profile of a hamstring, yeah, I think of it as like what you would see kind of in the desert, like one of those big plateaus where it's like, it's kind of boxy, but it's steep, and then there's like a gradual downslope, and then it drops off
For the hamstring. Okay.
for the hamstring. Yep,
So
it's
his
not a
does look
haystack.
Pretty good.
Yeah, it looks really good.
Okay. Okay. I think it all makes sense. Yeah.
Okay, very good.
Okay. Yeah, that was smart to record it. Genius. Appreciate that.